Good evening. Welcome everybody to the Concerned Veterans for America Policy Forum with special guest, Congressman OHalleran. I hope everyone is doing well right now and everyone and their families are safe. I'm Joshua Stanwitz, the Coalition Director for Arizona Concerned Veterans for America. A little bit about myself. I'm a generational veteran that served both in the United States Marine Corps and the United States Army. I have deployed to Europe, the Pacific, Southwest Asia, and Iraq, and I served in various roles, but they were all infantry related. From helo companies, the mechanized companies, the light infantry companies. I was even on an anti-terrorism team, and I served as a machine gun section leader. I currently live in Gilbert, Arizona with my beautiful wife, Carrie, and we have 2 sons. And I started volunteering with CVA about 4 years ago while I was working with Maricopa County Sheriff's Office. Again, we want to thank you all for being here. Real quick about CVA, for those of you who have not heard of Concerned Veterans for America, we're not a veteran service organization, we're a veteran advocacy organization. So simply put, our mission is to advocate for the freedoms that we as veterans and those before us fought so hard and sacrificed for to defend. We at CVA believe that veterans and military families offer a unique perspective in the freedoms we have at home, along with the policy that shapes this nation, and that's due to us having skin in the game. We've sacrificed liberties and freedoms to serve our nation here at home and conflict abroad while wearing the uniform. And due to this, our lawmakers and leaders, along with the general public, tend to listen when we stand together and take action and speak up. So when people ask what it is that we're doing at CVA, it's real simple. We're building a movement across the United States of people that are willing to be active and want to be involved and take action. And really, what better time for all of us to stand together and to take action than right now? During this unprecedented time while we're dealing with the COVID pandemic as a country, because literally it's impacting all of us on every level, from the government all the way down to the individual. So again, having said that, we're here today with Congressman OHalleran to discuss this. So thank you, Congressman, for joining us. And before I give it over to the Congressman for his opening remarks, I'd like to tell you all a little bit about Congressman OHalleran here. So Congressman OHalleran served on the Chicago Police Department, where he was commissioned as one of the youngest homicide detectives in the city's history. He served with distinction, receiving countless commendations and awards for his work to serve and protect his community. Following his service, Tom became a member of the Chicago Board of Trade and opened his own small business. So as a member of the board of directors, he chaired the finance, floor operations, and planning committees, and his work actually gave the Board of Trade a vision for the future. Never won the rust, Tom took on public service again upon retiring to our beautiful state here in Arizona. He served 3 consecutive terms in the Arizona House of Representatives and 1 term in the Senate. Congressman OHalleran used these 8 years in the legislature to take on many tough challenges and make the right decisions for his constituents. And that was always regardless of the political implications. For Congressman OHalleran, it is and always will be about the people he serves and never about the party or the title. Congressman OHalleran and his wife, Pat, live in an unincorporated part of Yavapai County, outside of the village of Oak Creek, and they've been married for over 50 years, have 3 children and 4 wonderful grandchildren. Congressman, thank you for joining us today. Thank you for your years of dedicated service as a police officer, state and federal representative. Would you like to make some opening remarks, sir?
Sure will. First of all, thank you for everybody for your service to our country over not only just when you were in the service or in the reserves, but our National Guard, but when you've been part of our communities and what I know that veterans mean to our communities long-term throughout, because you've served with distinction and you bring a lot to the community in form of structure and ability to reach out to the entire community. So I thank you for that. Arizona's 1st Congressional District is larger than the state of Illinois or the state of Pennsylvania or 32 other states in the United States. It takes up about 54% of the size of the state of Arizona in landmass. Obviously, all congressional districts are about the same size as far as population. Ours is just a little more spread out and means a little bit more drive time for me.
Absolutely.
We also have 12 Native American tribes. Each one of those tribes is unique in its own way, but it's also one thing I do notice with the tribes and with small town America and with most of America is their commitment to veterans. And I appreciate that every time I go there. if you don't like veterans, don't come to rural America, because you're going to be in trouble. We respect you very much. Our group, our district has about 45,000 plus veterans in it. We do a lot of work with our veterans. Rudy Cotta is online right now. He's one of our veterans outreach people. We have 3 of them. We're just about to bring on a wounded warrior into our fold. And we've been, my first 2 years in Congress, I'm there about 3.5 years now. My first 2 years was on military affairs. I enjoyed the committee tremendously. I'm now on energy and commerce. I had to give up military affairs because energy and commerce, the amount of work on that committee, it takes in the largest jurisdiction of any committee in Congress. And it's not just business, it's healthcare, it's the healthcare, every major medical bill has to come through that committee. Anything dealing with energy or telecommunications or any of the other many issues that involve commerce in our nation goes through that committee. Broadband, and then we have a tremendous amount of work that we do with the worldwide economy. So it's a very active committee. It's the longest running committee, by the way, in the Congress. The scope of that committee allows me to get a lot of information. I love my time on military affairs. I'm going to try to weasel in time on it again because the knowledge that I learned there and the ability to work with our armed services was just a tremendous education for me. And I think that it was a good fit for me moving into working with veterans also and understanding veterans much better. My 5 uncles all served in World War II. One of them was a bombardier on a B-25 for 50 tours over Southeast Asia, and many major battles. But I have his medals and stuff on my wall at the Capitol in a picture of him because at 96 years old, he wasn't able to get into a veteran's home in his final months on Earth. And that really bothered me. And so I spend my days every day when I walk into my office looking at that and trying to think about all the other veterans out there that need the services that we said we would provide you. And so we're going to continue to work on that. And I know within the last 2.5 years, 3.5 years, we've made steps forward to make sure veterans are cared for in a better way. We still have room to grow. And during this pandemic, we added another almost $20 billion to make sure the process works. My team and I have visited all the VA hospitals on a continual basis, both before and during the pandemic. We are in constant contact with VA facilities across the state to make sure that they have the amount of necessary elements to be able to meet their mission. And they currently do, other than the fact that they have to do a lot of their telemedicine issues, which we are going to vastly improve as we move into the future. I have veterans in Show Low or up on Navajo or other places that have to drive 5 hours one way to see a specialist down in Phoenix, and 5 hours another way. And these are people that are injured or sick. There's no reason for that. We have to bring service to veterans, not have veterans have to go while they're sick that distance. We have veterans now that because of the pandemic, in order to get dialysis, they have to do that same thing. Well, we stopped that. It was happening from the eastern side of the state. The company left because they had to consolidate, they thought. We brought them back and said, no, you're not going to make very sick people travel 3 or 4 times a week, 10 hours a day or 8 hours a day, whatever that was. So we were able to overcome that and many other issues over the past several months. But I am really looking forward to your issues that you want to talk about. I want to give you enough time to be able to do that. I'll be, no matter if you like me or not, I'm going to be with you. I used to tell, when I was in the police department, I was obviously for a while a patrol officer. Then I was in special operations for, well, after 6 months on the job. And then I went into homicide and gang crimes. I did that for a while. And then I became a supervisor, a sergeant at the time. And then I became a commander of a special operations unit on the department. And so learned not the type of tactics you do, but I learned a lot about tactics, and that helps me a lot within my skill set as identifying some of the issues that we have to work on and the realities of what we have to do, both under a pandemic and under regular circumstances. But most of all, it allows me to understand that you have to care for the people that work with you and the people that you work for. I'm sure that almost everybody I'm talking to out there clearly understands that. So let's move on to whatever you want, whichever direction you want to go.
For sure. Absolutely. Thank you, Congressman. And you hit a lot of stuff that we're going to talk about for a little bit. So, typically when we start these out, the very first question that we ask that is important is, how are your constituents doing right now during this time, and how are the veterans in your district doing? I know you mentioned that, there's some telemedicine, there's healthcare issues that we were discussing. How are they doing right now with this new level of uncertainty, especially since we're discussing reopening the economy here on Friday in some parts of Arizona, right?
Right. And, we have to move on as a country, but we have to do it smartly. And so, because you can't be under a constant state of not having your economy moving, but we have a lot of things that we need to put in place, whether it's testing or tracing or some of those other elements that, it's just like anything else. You need information and you need knowledge to overcome this type of basically an attack from outside. And this is an attack that you can't see it, but you sure the hell can beat it if we all work together. So I think the veterans are doing pretty well. The veterans facilities, as I mentioned before, are fairly well funded. I haven't heard a complaint yet. Rudy and the team, rest of the team, all go out there on a constant basis. Well, go out there this way right now on a constant basis and check in with all the different service organizations. We check in constantly with the VA. They get a call from us almost every day to identify where they're at, what their occupancy is, how many veterans are sick. And we do that with cities and towns. The staff is totally dedicated right now to addressing citizen issues during this pandemic. My Washington staff is doing similar work in relationship to all the bills that we have to put out on a continual basis. But there's not a time that we're not kept up to speed. In fact, when I get done with my day with calls and stuff and then eat dinner, I can spend the next 3 hours reading through all the reports on a daily basis that everybody sends in to me to identify what's going on out there. And then I obviously make a lot of phone calls too during the course of the day and the evening.
Okay. Yeah, you guys stay busy. I know that I've worked with Rudy off and on in the past, and your office has always been really awesome and supportive of veterans and on veterans issues. Before we get into some of the questions, I wanted to quickly address that you serve on several committees, coalitions, caucuses, and task force, including sitting as a co-chair on the Blue Dog Coalition, which I found very unique. Can you explain what that is and what you all do on that coalition for those of us that may be unaware?
Well, there's two things our coalition is wrapped around, our major focus, and that's the safety of our country and our budgetary processes, the cost and the safety of our country. And so that forms the basis and the nucleus of those members. Most of us are on the moderate side of the caucus. And so it lends that voice to others to be able to make sure that we keep within the parameters as much as we can, the direction that the citizens in our country feel like they want us to go. Both parties have these fringe groups there. Then you come in, and finally towards the middle there, you have people like myself or a bunch of the Republicans I work with in the Problem Solvers Caucus, and that's a balanced caucus of, right now it's 27 Democrats and 27 Republicans. It always has to keep its balance. And we meet every week. We have committee meetings amongst our caucus on a continual basis to bring forward ideas and concepts for the leadership in both parties so they can bring something forward that's helpful to meet the needs, the big issue needs of our country. And we have a great relationship with one another, and you can walk away from that table and still be friends. And that to me is the important issue. We can have our vision of what we want to see. We can have our ideas, and nobody should be able to condemn us as fellow Americans for what we think. Mm-hmm. We'll address the issues is from a value situation, but we need to be able to focus on that so we can come together.
Absolutely, Congressman. I know that you guys tackling the budget, the national debt has been a big issue that CVA has tackled for years now, and we've always considered it one of the largest threats to our national security. Just like the Marine Corps General Mattis used to say. So that's outstanding. You're also part of the Women Veterans Task Force. I know we're probably going to get a couple questions on that. Before we get into our Q&A, can you explain a little bit about that and what you all are doing, I should say, for our women veterans?
Well, the object obviously is, whether it's women veterans or my wife, they all have a different need within the medical area, the VA area, whether it's benefits or whether it's health care, you name it. We have to be able to provide, or mental health care, we have to be able to provide a broad spectrum of care for our women veterans and male veterans. But it can't be like it used to be. It has to do that important, and how we can find a way to recognize that difference. I think psychologically, I haven't run it. Rudy took the place of my former person down in the southern part of the district, and she was a Marine Corps drill instructor for 20 years.
Oh man! And
I always talked to her, and I thought, I would not want to take you on. She was tough, and she was. It took me 3 or 4 months to get her to say Tom. She was yes sir, no sir, all the way. I said, please, call me Tom. I understand when we're away from here, but we're here in the office. We're all the same. But we're all working for the same goal and objective. But she's tough, and Rudy's tough too, because he doesn't want any veteran to go unserved, and that's what we're there for. And you can't tell, after meeting her and being with her for a while, you can't tell me that she can't go out there and have the thought process of just any other Marine that's out there. She wants to serve, protect, and overcome the objective, and whatever that may be. And she served in Afghanistan and Iraq and everywhere else over there. So with honor. She taught me a lot. I have a woman, Paulette Yaze, up in the northern part of the district that does Veterans Affairs for us up there. And so of the 3, I have two women at one time. Yeah. So, but they're the ones that really said, we have to do something about women veterans. We have to. And then I found out eventually that there was a caucus on Capitol Hill. There's a ton of caucuses, but some are more important than others. And anything that deals with veterans and women's veterans or injured veterans, or you go down, or veterans that need psychological evaluation and mental health. When I first it took me a week after I got elected to find out that there was a freeze on hiring for the VA back in 17. Yep. And I said, give me a list, and found out that there were 1,400 empty positions for psychologists and psychiatrists in the VA, but they couldn't hire anybody. Well, that had to stop. So we led an effort to help stop that, and it stopped within a week, and got that moving, because we again, I talked to you just before, we have an obligation. I know that if somebody signed a contract with me and I said, this is what I was going to provide, and I didn't provide that, then I'm not working on that contract from a side of fairness and justice. And so we have to do that with our veterans too.
Outstanding. Well, transitioning to legislation and policy that impacts veterans, you're a supporter of a lot of VA reform efforts, a lot that we've pushed through with VA accountability. The big one that you supported was the VA Mission Act that was passed in 2018.
Right.
I'm sure a lot of vets in your district are familiar with the community care provision that allows them to seek care outside of the VA if they're eligible. This is definitely crucial in the more rural areas, like in your district. Currently, the VA has instituted a pause on these referrals. And there's a lot of confusion surrounding this and community care because it is a law. Do you have any concerns on how this may impact the veterans in your district and throughout the country on getting the health care they need?
Well, I do, and there's a multitude of reasons. I think they need to go through a reevaluation on reimbursement rates. They need to go through an evaluation on the timeliness of their paying the provider network that we depend on out there. That's been very slow and cumbersome. And unlike the VA, they're going to get a salary, they're going to get the providers out there, and there's so few of them, especially in the rural areas of America, that they have a tremendous caseload that is going to pay through the private insurance faster than the VA does through their insurance. So we're trying to speed up that process. We're trying to make it so that there's a certain percentage of cases that they have to take if they want to be a provider. And also importantly is we have to find ways. I have a bill that will try to get residents out into the area out there so that we have residencies in the hospitals in rural America because most of the residencies are in urban centers. 60% of those people that graduate from their residency, the follow up to their health or healthcare education in the first place to become a doctor, they about 60% stay right where they are, either in the hospital or in that region. We need to get those people out there. And then how telemedicine is going to factor into this. We have a huge piece of legislation going through, hopefully with this CARES Act, because we found out whether it's the military or the rest of the citizens in rural America, the telemedicine that's out there now is not the telemedicine we should be planning for the future. And we need to have much more capacity. We need to be able to make sure that our veterans, no matter where they're at, whether they're in their home or not, the systems that they have in place where you can stay in your home and get checked on, in many cases, it doesn't work very well. So we have to do that, and how that is structured around the entire Mission Act and the ability to have community health care. We're looking at the entire process of community health centers and how they can become more active in the area and any of the waivers that we might have to give there. But all in all, I think most of this wraps around the other issue that I'm concerned with always is the specialty type of care some veterans need over the general population.
Of course.
And so we need to be able to get that to them. And there's a whole lot of doctors out there that have dealt with trauma from the standpoint of car accidents and stuff like that, but not the type of shattered bodies on an ongoing basis that we see from our military.
Fair enough.
The needs those have.
Yeah, absolutely. We've been talking about telemedicine and telehealth a lot frequently, and I know that it's to me it's going to be the wave of the future. I've used it during this pandemic. I enjoyed it. We've had to use it for my sons and my wife. It's been extremely helpful for all of us. I know that the VA has switched a lot to telemedicine while this is going on. You've mentioned that some veterans are accessing it well. What has been the general feel within your district with the telehealth that the VA has been providing to the veterans? Are they liking it? Are they still having issues with it?
I think we're on the mental health side. I think we're getting over some of the initial concerns about not having one-to-one and getting over the idea that I'm talking to somebody that's not in the room and can't convey myself as well. But that's slowly coming to an end. I still think there's a problem with this sense that, why shouldn't I be able to get better service than somebody that's 300 miles away?
Yeah.
And why don't they care about me? And I don't blame them for that. I mean, it shouldn't matter that a veteran lives in Podunk, Iowa. They deserve the same level of care as any other veteran does. It shouldn't require, as I said before, that veteran, the specialist needs to come to us. They shouldn't have to have the patient go to them all the time. The specialist needs to be, now, as we go into the future, and that's why broadband and high-speed internet is going to matter with telehealth. As you know, in the battlefield today, we have doctors from all over the place being able to operate with robots and so forth on our soldiers in the battlefield, or at least in the aid station. But that is something that's going to be seen more and more throughout the world, on especially elective surgeries or some of the minor stuff in relationship to what you see out there today. I don't envision open heart surgery anytime real soon, but I do envision the type of joint surgeries and other things that you can do now. They do it, in fact, in the operating room right now in almost every major hospital. And there's no reason why it can't be done somewhere else, as long as there's another doctor that is like an emergency room doctor that somebody knows there is an emergency, you can take action, but they're not the specialist that can perform the surgery themselves.
Well, Congressman, thank you. You're right. That's always been our stance. It should not matter where you live. Veterans deserve the best healthcare possible wherever possible. Now, moving on, we're going to do one more question, then we'll open it up to the audience, so I can let you answer some of their questions directly.
Sure.
Regarding the length of time that we've been shut down as a country, including the healthcare systems and the amount of medical appointments that have been canceled, non-serious care, all kinds of various healthcare appointments. Do you have concerns with the potential of another backlog occurring, similar to what we saw with the Phoenix VA several years ago in 2014 with the wait list?
I don't think it's going to be allowed by Congress to have that type of a process. In fact, as you know, right now the wait time in rural America is longer than the wait time in most of our VA hospitals. And that's because of the lack of providers to be able to address that load factor. So, and again, we've put a whole lot more money into the process, and I don't necessarily take anybody's word necessarily for, yes, we're doing our job. So we follow up on a consistent basis to make sure if somebody tells me don't worry about it, then I'm going to worry about it, because I want some information other than somebody just saying, oh, we're taking care of that. No, that doesn't work in our office. And but I haven't seen anything. I mean, of course, you have to go through security. You have to have a mask on now.
Yeah.
You have to be able to address your issue. I've had many instances now where we've had some issues with mental health, where a soldier or vet will get flagged, and it disturbs me because we can set up safety issues within the hospital environment to make sure the staff is kept safe, but that soldier and veteran is cared for appropriately, because their underlying condition is part of the problem of why they're doing what they're doing. And there's a lot out there that we have to address. Most of it, I think, addresses with the higher level of administrative professionalism across the entire structure, and not just worrying about your next job. And I'm not saying that's pervasive, but I am saying I know that it happens. And in the private sector, you're gone. In the public sector, we'll send in another person and another person and another person, and they're going to be acting. We got to get the right people and get them in there and pay them the right amount of money so that we have a good system. And we have to provide the spatial issues within our hospital systems that are competitive with the private sector. And if we can get a number of veterans cared for appropriately, we can relieve some of that structural burden and put it onto the private sector, where I think there's plenty of qualified doctors, but we just have to get the reimbursement issues addressed appropriately. But I have not seen during this crisis necessarily in this state a real backlog occurring that is going to hinder that. Now that, they can't take everybody in right now, but at least they're doing the telemedicine and other things. And in emergencies and serious situations, they're taking people in.
Okay. Well, Congressman, thank you for that. So we're going to get into some of the crowd Q&A really quick. We have everything from healthcare to national spending on here, so I'll start tackling them with you. One of the first ones you have from a gentleman named Shane in Arizona is, what steps can Congress take to ensure more Arizonans have access to quality and affordable healthcare during this public health crisis?
Well, there's two things. I mean, we're looking at a number of alternatives, but I'm sure most of you know that the worst thing you can do right now is have us go out there and continue this fight over healthcare in America. We have to focus and take our eyes off the ball that everybody in America, whether they have private insurance, Medicaid, Medicare, VA, you name it, we need to care for them under these situations and make sure they have health care. And this ongoing dialogue we have between whatever element it is, I don't like a Affordable Care Act. I want more private hospitals and VA. I mean, it runs the entire gamut. This is not, we have to be structured on what the objective is. The objective right now is to get our country through the healthcare situation it's in, and you can't do that while arguing. And we have to get through the economic situation that our country is in right now. And again, we have to bring together people, especially in Congress, so that we can move these objectives forward. And so I just, my thing is, I don't want to hear about anything that's not an emergency other than addressing this issue. It is so important, and it is going to be with us for a while, I'm afraid. And every major economist I've talked to clearly identifies that this is going to be far worse than 09 and 10. And we are in just a major recession coming up. Unemployment rates are going to be somewhere around 15% for the rest of this year. They'll come down from where it's at now as it opens up, but it's still going to stay at about 15%, down to about 9% over the course of 2021. Now we're getting in some areas that are more reasonable to work with. And then hopefully our job right now is to make sure we protect the lives of the American citizens and have the strongest economy in the world coming out of this, and productive economy. And that's our goal. And if we start allowing ourselves to get diverted into all this other stuff, and I see it on both sides right now, I just feel it coming. And one of my jobs is to try to say to people, is that really addressing COVID-19? Because it isn't, you better justify how it is. And justify it to me, because we need to be focused totally. It would be like you guys in the military, you're going, well, some general wants me to go over here and the battle's over there, and he hasn't given me a reason why I should go over here. So just give me a reason, I'll go. But for crying out loud, make sure it's part of winning, not part of just moving along and treading the water, or trying to come up with a solution to something that's been being worked on for 5 years.
Yeah. So we have several questions here, specifically because I brought up your stance on the Blue Dog Coalition and various national debt questions. So I think the big one here that multiple people have asked is, the Senate is looking at bailing out decades of poor budgeting in several states, with none of those funds going to help the states that have been hardest hit by the COVID pandemic. Do you support the bailout and the local where are you at on the bailout in the House and how they're feeling with that and where it's going? Because I mean, both sides.
Go ahead.
I was going to say right now we're cashing checks at the largest level that I think we ever have in the history of the United States. So,
Yeah, I've had because I'm in the position I am, I've had the ability to talk to 3 of the former secretaries of the Treasury in past years, both sides of the aisle. And they all agree that this is the most severe economic issue we've ever come through in our lives. And the burden that the cities and towns and counties and everybody else has to apply the formula we're using is that you have to prove that your expenditures were in relationship to COVID-19. Don't tell us you want to bail out for your debt. Don't tell us you want to bail out because you did some things you couldn't afford. We want you to be able to keep your police officers, your firefighters, the members of your staff on. We have enough unemployed people. We need to keep people employed, and we definitely need to keep people employed in a vast array of areas within government, but not that aren't. If you can't fund your money for a secretary, then the secretary has to lose the job. But we have to keep the critical aspects of our cities, towns, and counties up and going. Having said that, things are moving so fast. The Senate has a bill out of the Republican side that wants to spend $500 billion on cities, towns. There's a recognition of that over there. On the House side, we're somewhere around $750 billion because we go past the towns of 50,000 and above and down lower into the rural areas of the nation. What's happened in these cities and towns as taking on this issue is that they haven't been bailed out. They've been just clobbered by the lack of revenue coming in to these cities and towns. And the highest paid people in many instances are our first responders or our hospitals, with a county hospital here and a county hospital there, or the other processes that are up and going. And the health departments and all that. That is all a huge expense that is just not being addressed right now. And they're required to do it. So it's way outside the area of pandemics. Then we have hospitals that we're told you can't do elective surgery anymore. You can't do this, you can't do that. Everything has to be towards COVID or emergencies. And that means that a lot of hospitals, that's about 60% of their revenue flow into the hospitals. They're going to have to prove it, but we can't afford to have the hospitals of America. In fact, we're going to try to get more infrastructure into hospitals so that as we move into the future, we can have hospitals that are, the intensive care units are constructed so that they can take on this burden, and ventilation systems can be better and stuff. And we have to be ready for the infrastructure that's coming forward. Right now, the administration wants to make sure that the cities and towns are going to take on a lot of this additional burden. Well, I know going into this, and you know, their pension plans on a state level especially are across the large. Arizona's not as bad as other states. They're not great, but they're better. When I came into the legislature, cities and towns were giving like 2% to the principal or to the payment for retirement. We cranked that up to about 8-9% because the principal was just going down and down and down. It was not going to meet the obligations. And it's not fair to give future generations that obligation just because you wanted to keep your costs low at that moment in time. Right. So we are going, if we don't do this in some form, we are going to be overcome with taxes on the state and local level, whether it's sales tax on the local level, property tax on the county level, or income tax on the state level. And it's going to be that much harder for that particular state to be able to get out of it. And sadly, I think almost every one of our states right now, they need to solve their pension problems.
Oh, yeah.
I'm not in the favor of bailing out bad management on pension plans, yeah, or overpaying for too many employees. We're directly pointing this at paying for the virus that's attacking us. And just like if we had a kinetic war and somebody went and said, we're at 500, or actually, let's use the Marine Corps. You got the Marine Corps behind you. Let's use the Marine Corps. We're at 100 and some thousand Marines, and we had to pop that up to 500,000. Nobody's going to argue that. We got to do it. We got to protect our country. And on the same side over here, we have to protect our country. 75,000 lives could have just as easily been, if we didn't shelter in place, if we didn't take, every expert tells me 500,000 would have been an easy number to get to. And we still have no guarantee.
Yeah.
And we still have no guarantee that we'll have the therapeutic drugs necessary for the fall and into the winter. And we still definitely no guarantee that we have a vaccine, because there's never been a vaccine for a coronavirus.
Yeah.
They've never found one for a human being.
Okay. Well,
There's struggles we have to go through.
that's fair, and it's a lot. The nation's definitely in an extremely unique place for everybody. I don't think anybody's ever seen anything like this. So
And I don't think I'd be fair by not saying there's a difference between a structural deficit that we've been used to and a deficit over here that you're paying 0.25% on. It's going to be a lot of money. You're going to be seeing $5-6 trillion, but it's still a principle though. Sooner or later, it's still on our books.
yeah,
But it's a different principle than getting loans that are on our books at 8, 9, 10% or more.
absolutely. Well, we got time for one last question from the
I
audience.
talk too much, I think.
Oh no, that's fine. That's fine. And then we'll let you close it out, and then I'll close it out here, Congressman. So one of the big things that we've been talking about a lot tonight is telemedicine and telehealth. With Congress taking all the steps to expand access to telemedicine and telehealth and all the teletechnologies, we've had multiple questions here from rural residents. How is that working in the extremely rural areas in your district? Out on the nation in the tribal areas, are they even able to access it, or are they not? Is there bandwidth issues, et cetera?
It's in its beginning stages. And that's why broadband is so important. You have to have high-speed connectivity to be able to address those issues. And in fact, for rural areas, you need three things. You need it for education, because our children are just as important as a child anywhere else in America. You need it for healthcare, because families will not move in. In fact, families will move out if you don't have appropriate healthcare. And you need it for economic opportunity because of the knowledge-based economy. So that's why we're looking at an $80 billion of funding in this next bill, it looks like, for broadband. Because mostly of healthcare and what we've learned through this struggle, mostly of being able to get our messaging out to the vast amount of the American public that still don't understand how they get a business loan and how they get on unemployment or how they do any of these other issues that we're trying to get through this. And we can all look at this as a learning experience, and we should. But I'm hearing more and more from whether it's a tribal nation or one of our cities, towns, that they're getting more and more used to telemedicine, but it's not as personal. We have to try a way to get over that. And that means you just can't have telemedicine. If that provider is the person that's doing telemedicine on me, again, once a week, once every so often, they need to get their butts out to rural America and shake your hand and look at your face and touch your abdomen and find out what's wrong with you, or unless you have another doctor that really knows what they're doing for that specialty to be able to do that. Otherwise, it's not the type of care that other Americans are getting.
Yeah, agreed. So actually, I want to ask this question before I let you close it out, because I think this is really important, and it involves your communities and your district. This is from Matthew in Arizona, by the way. Are there currently any community organizations that are stepping up to the plate to care for your at-risk demographics that your constituents and that these demographics or veterans should be aware of? Are they helping with grocery shopping? Are they delivering supplies? etc. Do you know of any? I know of a few that I can name off if
Well, it's too numerous to, there are tons of people. That's what makes America great.
it's
I
awesome.
mean, it's hard for us sometimes. It's like a family, you know. Sometimes you argue and sometimes you don't. This is not the time to argue. This is the time to come together. And I think I got a call from the county manager down in Sierra Vista, not Santa Cruz County, and they called me up and said, we have these warehouses full of food, and we need to be able to get them up to the Navajo or the White Mountain Apache or up to some of the other cities and towns that are having hard times with deliveries. They were willing to do that for a nominal amount of money and get them up there, and they did. We have volunteers from all over the world. Luckily, I'm Irish, and the Irish are sending $3 million over here, or 3 million pounds, because they got $170 in the 1800s from one of the tribes.
That's awesome.
And they're going to northern Arizona for that. I mean, that's just what it's that camaraderie that veterans have and that we have in times of crisis. When you look at crisis in America, it's in part of our genes that we overcome that crisis, that we understand that it's time to bind together. Are there people protesting? Are there people yelling and screaming? Sure there are. That's also part of our ability to be free, to be able to exert those thoughts. But in the end, we are resolute, I think, in being able to overcome this. And that's why we've won wars and helped, not that you guys haven't won the wars, but we as a country have stood behind you and won those wars. And we will always stand behind our country in a time of crisis together. And that's part of the key to what it is. And there's a ton of groups out there. I have groups calling me up all the time. How can I help? How can I help? I'll send this group and that group.
Yeah.
So.
No, that's thank you for touching that. I mean, at the end of the day, we all are Americans. We are on one team, same fight, and Americans are extremely resilient. I know that locally there are a couple of groups that are assisting with the tribal communities up there. So if anybody's listening and wants to get involved with those local groups, Andrew Jones at AJ Impacts is heading up the donations, and Ro Gonzalez with Valor's Veterans Community, along with Beckett Honor House. They're taking donations and delivering to the Navajo Nation and the tribal nations up in Congressman OHalleran's district. So if you're in the Valley, feel free to help out. I know that in Northern Arizona, there's another gentleman who volunteers with us named Alan Arnesto. He runs Grunt Charities and Brotherhood of the Blue Cord, and they do a lot of volunteer work in Northern Arizona as well. So moving on from that, Congressman, is there anything you'd like to say to close this out?
Just again, thank you for your service. I've always looked upon our military as the foundation of America, and we wouldn't be in America without the military. I think, at this point in time, those words command and control have to be in place. At this point in time, I wrote a letter to the Vice President about, please get the military involved, because they're the best logistical people in the world, and we need logistics, and we need to keep you guys fully involved in this commitment. And sadly, I'd like you to look around strongly and look around your cities and towns. There's a possibility that within the next month, they might be the town in trouble. And so that's why your question is so important. Are there people reaching out? Yes. And if it's your town next, we'll reach out to you, and we'll reach across borders to New Mexico, or I don't know about California, but we will. We would reach over to California and everybody else, because this is something you can't look at and say, we can easily overcome this. And that's why it's so important to keep a sense of humor, to make sure you have a smile on your face, and make sure you keep your family safe. Please keep your family safe, and take the precautions that the CDC and others across the nation, across the world are recommending, because that's one of the best pieces of ammunition we have to defeat this right now, is to not infect one another, because this is how this thing works, and it's sticking around right now. you know, we thought, okay, summer's coming, don't worry, it's just like the flu. It's not. You know, we've lost over 75,000 people right now. We're going to lose a lot more, sadly, between now and the fall, when we're going to have to be ready. And that's what we're doing right now. We are getting ready. Some of this money you're seeing spent is not about today. We have the money for right today as far as supplies and stuff. It's about tomorrow. It's about being able to be ready for this thing and not letting it creep up on us. And as soon as it raises its ugly head, we will attack it. We will get personnel and the supplies and everything else that is needed, just like the military does, to be able to overcome that enemy and take it over. And the best thing for you guys is, and ladies, I hope your families are safe and well. And if you ever have a problem, get a hold of our office. You know, we're there to serve you. That's our job. And we have some of the best knowledgeable people in the United States to be able to do that for you. I know that because I watch them work. And I'm always amazed. It's something I don't think I could ever catch on to fast enough to be able to help you. But they can. And I know that they care also. So please go online, get a hold of us on our official site, and come on board. And if you you want to help other people, get to your service organizations first, I think, because they're right into this. And then if you want to find something else out, get a hold of us.
Absolutely.
So thank you very much.
Absolutely, Congressman. Thank you. And thank you for your service, for all of your years on the police force as a public servant, as a state representative, and as a federal representative. Again, I wanted to thank everyone for attending tonight. Especially would like to thank Congressman OHalleran again and his staff for helping us set this up. You know, so thank you again. It has certainly been an honor and a privilege to have you on tonight with us. For anyone in Congressman OHalleran's district that may need help or would like to contact them, please go to ohalleran.house.gov. For any veterans out there that may need assistance, please reach out to Rudy Cotta. Rudy is the veteran service representative for Congressman OHalleran. I've worked with him for a few years now. He's amazing. His phone number is 520-316-0839. And his email is rudy.cotta, the number 3 at mail.house.gov. That's RUDY period COTA, the number 3 at mail.house.gov. For those of you all that would like more information about Concerned Veterans for America, what we're doing nationally as well as locally, you can find us online at Concerned Vets on Twitter, Concerned Vets for America on Facebook, locally here in Arizona at AZ Concerned Vets, Veterans for America on Facebook and Twitter. And for those of you all that would like to get involved or would like more information on how we do stuff at CVA, would like to become an activist or volunteer, you can go to www.cv4a.org and click Take Action, and you can follow not only what we're doing locally but nationally. If you are locally and you ever need help, or if you need to be put in contact with the legislator's office or a veteran organization, feel free to contact me personally. My phone number is 480-322-0373, or via my email at jstanwitz@cv4a.org. That's JSTANWITZ@cv4a.org. And again, I just wanted to thank everyone for joining us this evening. Congressman, your staff, you guys have been amazing, and thank you for all the work that you do for the veterans and again for the tribal nation in your district. Everyone have a good night, and thank you all for attending.
Good night. Thanks, everybody. Thanks, Jeff.